Welcome to today's press briefing. The doctors today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Dr. Au will tell us about the new cases. Members of the public and media friends, good afternoon. I'm now going to report the cases reported yesterday on the 5th of May. Yesterday, from PCR test, we have confirmed 144 cases. Among them, 28 were reported by the HA, 22 by the Public Services Laboratory. The remaining 94 cases were reported by private laboratories. On the other hand, via RAT, yesterday there were 180 positive cases. In Hong Kong, in total, yesterday we had 324 positive cases. So far in the fifth wave, the accumulative number of infection is 1,193,410 cases, including 746,685 PCR positive cases and 446,725 RAT positive cases. Among the cases confirmed yesterday, 29 were imported. The remaining 295 were locally infected. Among the imported cases, 11 were identified as the temporary specimen collection center at the airport. The cases involved 2 passengers via CX252 from the UK, 3 via SQ894 from Singapore, and 3 passengers arrived at Hong Kong on a QR818 from Spain and Holland. 1 passenger arrived via PR300 and 1 from MH072 from Australia, and 1 passenger from CX495 from Taiwan. The remaining 18 imported cases were all found to be positive during hotel quarantine, including 4 tested positive on the 3rd day, including 2 RAT and 2 PCR tests. 4 were tested positive on the 4th day. 9 were tested positive on the 5th day, all via PCR. 1 case was tested positive on the 7th day. 4 cases were from Singapore, 3 from Canada, 3 from the US, 2 from the UK, 2 from Germany, and the remaining 4 cases were from Korea, India, Vietnam, and France. In terms of genome sequencing, yesterday the Public Services Laboratory has performed genome sequencing for 84 samples. No L452R strain was found. 79 samples were tested negative to L452R strain. The remaining 5 cases were of insufficient viral load. For care homes, no new cases were reported by care homes which have experienced infections. 2 elderly care homes which have previously reported infection have reported 1 infected resident. Another one involved a staff member. For schools, today, more than 2,300 schools have resumed in-person classes. From the reports this morning, we learned of 23 new cases involving 23 schools. 15 were students and 8 were staff members. Among the 23 cases, 22 were found via RAT, 1 was PCR positive. They involved 2 kindergartens and childcare centers, involving 1 student and 1 staff member, and 14 primary schools involving 9 students and 5 staff, and 7 secondary schools involving 5 students and 2 staff members. In terms of the samples, 13 samples were taken this morning, 9 samples were taken yesterday. The remaining 1 case, the sample was gathered on the 4th of May. Among the 23 cases, 2 are from the same household involving a teacher in a school and a student in another school. For schools, so far there are no cases with epidemiological links. In terms of death, so far, in the fifth wave, Hong Kong has recorded 9,131 deaths, an additional 11 compared with yesterday. The mortality rate generally is at 0.765%. For those above the age of 80, the mortality rate is 10.46. For the new deaths reported yesterday, 4 were previously deceased patients. They were found to be positive patients during the autopsy process, involving 4 persons, 2 males, 2 females, aged between 68 and 76. 2 patients passed away in March, late March and April, respectively. 3 were chronically ill patients. Now, Dr. Lee, please tell us about the HA. Good afternoon. So far, 1,075 patients are receiving treatments in public hospitals, North Lantau Infection Control Center, and the CHP's Infectious Disease Center. No new critical patient was reported. There was 1 serious patient, and 2 critical patients are in ICUs. And also, yesterday, 7 deaths were reported. An 87-year-old female passed away on the 21st of April, and 6 persons passed away yesterday. 3 males, 3 females, aged between 74 and 93. None of them were from care homes. Among the 6 disease patients yesterday, 3 did not get vaccinated. 2 got 1 dose, and 1 got 2 doses. Yesterday, 151 patients are recovered, including 105 discharged. So far, in the fifth wave, 48,643 patients have recovered, including 47,943 discharged patients. Since the early 2020, we have 610,230 people recovered and discharged. 1 person was found to be positive on admission, and there was 1 close contact in ward. For staff, we have 22,554 staff members infected, and 22,420 of them have returned to their positions. Thank you. Now we will take questions. Please raise your hands and speak through our microphones, and please identify your media organizations. The lady over there.
I'm from Ming Pao. I'm sorry, I have a lot of questions. First of all, I would like to ask Dr. Au. You talked about care homes. I didn't hear you very clearly. How many elderly homes reported cases? How many staff members and residents were involved? And for the schools, recently, there have been cases in schools. So are these schools having new cases? And the European Chamber of Commerce has sent a letter to the Hong Kong government. He says that the CT value threshold in Hong Kong is set quite high. So for the imported cases, what would the CT value be if you consider these cases positive? And is this the same as other CT thresholds? And for the places and countries that have more communications with Hong Kong, what's their CT value thresholds? And for travelers, if they have been infected recently and before they board a plane to Hong Kong, do they have to provide a negative PCR result? Because they say that it's quite difficult for them to obtain such a result, and there may be positive cases. And also the Chamber of Commerce says that for the travelers coming from abroad, can they self-monitor themselves by quarantining at home for 4 days? And Dr. Leung Park Young said that for the overseas travelers, they should be allowed to be home quarantined in Hong Kong. Is that possible? And in April and May, how many cases were found positive after the 4th day? And in April and May, how many flights have been suspended according to the suspension mechanism? And for the online reporting platform for people who got vaccinated overseas, it was used before, and when was it stopped? And now you are seeing long queues at post office, and you are only reopening the platform now. Is it too late? And for the 21-year-old man from Indonesia, he was confirmed last March. So how about his genome sequencing? Can you give us an update? Well, how many people were tested positive after the 12th day, and how many new cases, how many of these cases are positive? Thank you for your questions. Well, for the care homes figures, I was not too clear. Today, we do not have new reported cases from care homes, and yesterday we received 2 reports concerning 2 care homes. One care home had a resident that was tested positive, and for the other care home, a staff member was positive. And we have carried out epidemiological investigations, and for the close contacts of these patients, we have issued quarantine orders, and we arranged for them to be quarantined. As for schools, every day we would receive reports from schools, and such cases would be recorded. And we would also carry out researches and investigations. We would do analysis, and we will try to find out whether there are clusters. And if for several consecutive days there are cases in a certain school, then we will try to find out whether these cases are related. Are these people infected in the school? Is there an outbreak? Or these cases are not related? These are just community cases. For the last 7 days, well, on the first day, there were schools that reported cases, but these cases were obviously not related to the school. In the past 7 days, 7 schools reported 2 cases or more, and 6 of them reported 2 cases. For one school, 3 cases. We have looked at the distribution of these cases, and we find that they are not related. These people do not know each other, and there's no evidence showing that they got infected in the school. These are infections in the community, and they do our ATF every day, and after they tested positive, they didn't go back to school. And one school reported 2 cases. I have explained about those 2 cases yesterday. They belong to the same family. They are siblings. So according to the present evidence, we do not see outbreaks in any school. And for your third question, it's about people traveling to Hong Kong. Now we have a prevention measures. We want to prevent coronavirus variants from entering Hong Kong. This is a very important measure. So every traveler, before he arrives at Hong Kong, before he boarded the plane, he needs to have a negative test result within 48 hours of his departure. And for those who have just been infected or those who have just recovered recently, we do not encourage to come to Hong Kong. Now, for an infected person, he should be isolated until he recovers. And in Hong Kong, even when we have cases, if the patient has received 2 jabs, he should be isolated for 7 days. And on the 7th day, his PCR or his RAT test should be negative. So before boarding the plane, a traveler must have a negative test result. It is very important for preventing the spread of epidemics. So when they arrive in Hong Kong, a PCR test will be done. And we can discover any imported case immediately by doing so. And at the airport, we have a private laboratory. The Department of Health has assured that the laboratory is up to our standard. It also follows international standards. it carries out a PCR test, and if the test result shows is positive, it is a confirmed case. And if people are recovered from COVID overseas, and before they come to Hong Kong, they were positive, and upon their arrival in Hong Kong, they also tested positive, then we will make a risk assessment. We'll find out what his CT value is, or whether this is a repositive case, and if we suspect that it's a repositive case, we would allow him to go to the quarantine hotel for isolation. Well, for quarantine, everybody would receive the same treatment, no matter whether it's a positive case or not. The traveler should be quarantined for 7 days in the hotel. And also for your question concerning the case imported from Indonesia, the sample of the patient was sent to our public laboratory, but the viral load is very low and the CT value is 38. Because the viral load is too low, we cannot do genome sequencing. We think this is an imported repositive case. And up to now, for imported cases in Hong Kong, 60 to 70% of them were discovered at the airport. And for the remainder, most of them were discovered within 7 days during their quarantine period. And for a small number of the cases, they were found out after their quarantine period. Mostly it is on the 12-day test. And we have recorded 18 cases after genome sequencing. They are found to be local cases. As for the remainder, they are imported cases. And we think they are all repositive cases. For 13 of them, before they arrived in Hong Kong, they were already positive. And for the remaining 3, the CT values were high.
For the testing performed in the airport, we follow the international guidelines. The laboratory would follow that set of guidelines. For different platforms, they follow different readings. So we follow the guidelines of the laboratory. Next, the lady over there. Good afternoon, doctors. I'm from TVP. Now, there are an additional 3 patients with chronic illnesses. So what are those chronic illnesses? And what about the information about the deceased patients? For the additional death cases reported yesterday, 4 have passed away previously. Their bodies were sent to public mortuary. Upon a further test, they were found to be positive. Investigation is still ongoing. At least 3 cases were chronic patients, including hypertension, diabetes, and dementia. Investigation is still ongoing. For the remaining cases, Dr. Lee, I don't have additional clinical information about those cases. Like I said, there are 7 deceased patients. 1 passed away on the 21st of April. The remaining patients aged between 74 and 93, they passed away in hospitals. If there are no further questions, this is the end of the press briefing today. Thank you.